Hi, thanks for joining us. I'm glad also to be joined today by Dr. Phil Mills. Welcome, Dr. Mills. And you're a dermatologist. Every day your practice goes skin deep and maybe further. We're glad you're with us. I have a personal issue to bring up, if that's okay.
Yes.
I was working in the woods the other day here near the campus, actually on the campus, and we were getting rid of some underbrush and different things. And when I got home, everything seemed fine until like the next day, maybe, I don't know, 48, 72 hours later. And then this started to develop. I'll just show it to you. What do you suppose that is?
That's a poison oak or poison ivy dermatitis.
I think that's exactly what it is. And I got to tell you, it's not the most comfortable thing to have. It itches, and so I have a couple questions about, first of all, how can I put up on the internet who's going to help me, and someone said, well, the best thing to do is amputation. That wasn't helpful. Others said prevention. I think that's probably true.
It's too late.
It's too late. It's too late for that. So what do we do to treat something like this? What can you tell us about
Well, the first thing to do is prevention. Everybody should know exactly what poison ivy, poison oak looks like.
What's it look like?
It has 3 leaves. It's distinct. And so you should really memorize what it looks like and avoid it. The problem is it has a little oil, which for 85% of people has a contact dermatitis. And that oil is given by the plant, particularly if you just break a leaf, their oil will come off. And that oil, unless it is washed off with soap within 10 minutes, in a susceptible person, they'll develop this dermatitis, which is incredibly itchy. Now, the first time you're exposed to it,
first time you're exposed,
nothing happens. So, but what it's done is it's sensitized your body. The next time you're exposed, if you are allergic to it, then you'll develop the poison ivy. And you can get it actually from pets who are roaming around and they come back. You also, if your trousers or clothes rub up against it, you take the clothes off and then you rub up on against the oils, you can develop it that way. If you've been exposed, now I had a terrible poison ivy attack when I call it an attack, when I was just a child. And after that, I have avoided poison ivy
like the plague.
Anywhere. I never want any exposure. Very, very careful. Now, if you get it like you've just gotten it, every exposure this season will be worse. You don't get a decreasing sensitivity to it. It actually increases the sensitivity over the season.
So those clothes, let's say you go home, you take the clothes off, do you throw them away? Do you burn them? What do you do with them?
No, you put them in the washer, and the soap can take the oils off. I jump in the shower and completely wash off. And I can tell you, I have been very, very careful, and as far as I know, I have not had any poison ivy dermatitis or poison oak for many, many years. But I am fanatical about it.
So the best thing to do then is, of course, to avoid it. But if you get it, within 10 minutes you wash it off. If not, then you're just going to have it. How long is it going to last?
Well, it all depends how severe it is, and depending on the severity depends how you treat it. In a severe case, you're going to have to take an oral medication called prednisone. Most physicians, if they're not dermatologists, don't give enough and don't give it long enough, but it really can cut the symptoms down. In addition, giving in these severe cases, you may need some topical medications as well. For a mild condition, over-the-counter anti-itching medication can work.
So with this very important subject, we've learned some very important things. First of all, prevention. Probably, do you have a text that could help us?
Yes, touch not, handle not.
Touch not, taste not, handle not. Okay, and that makes perfect sense. So touch not, taste not, handle not, and if you do, wash it off rapidly, and then treat the symptoms, if you have gotten it, by, seeing your physician, or there are some soaps and different things you can get. Go to our website, NEWSTART.com, for more information on this and other subjects. Thanks a lot for joining us, and thank you, Dr. Mills, for being with us.
Thank you.